Veterans are not the only people that suffer from post-traumatic stress. Victims of violent crime suffer from post-traumatic stress. Battered spouses suffer from post-traumatic stress. Significant medical issues that are sudden and life-altering, such as a CVA, can result in post-traumatic stress. One of the major criteria for the diagnosis of post-traumatic stress is intrusive thoughts, nightmares, inability to obtain restorative sleep. Many people suffering from post-traumatic stress currently are being treated by myself and other certification physicians. We cannot certify them for post-traumatic stress. We certify them for their chronic pain and many of the associated symptoms that they have with post-traumatic stress. And we get what's called a fortuitous side effect in medicine, where, okay, we can't certify you for this, but you've got something else and you'll gain benefit with this because you're treating something else. Post-traumatic stress has many things that are associated with it. It's not just a problem for an individual coming back from combat or a battered spouse. These people have higher rates of divorce. They lose their jobs because they can't function anymore and they withdraw from society. They commit suicide. 18 suicides a day was the number that I heard. That's amazing. I know that the VA is really concentrating right now on the risk of suicide in returning veterans from Iraq and Afghanistan. This has been a problem for some time. The main issue with marijuana and post-traumatic stress is the current mainstay of therapy is cognitive therapy. Basically, post-traumatic stress is people that have a stressor and they do not have the coping skills in order to deal with those stressors. They need to be taught those skills. The arguments that you will hear from the people that do not want to use medical marijuana with post-traumatic stress is that, oh, they're not in the present tense, it interferes with their cognitive therapy. Now, I'm going to be very blunt. Cognitive therapy lasts for years. And if it's a matter of going into therapy for 5 years versus 6 years, that's a small price to pay for somebody that's going to do a .44 caliber taste test because they cannot bear their life anymore. We make a big play in medicine of involving patients in their own therapeutic decisions. Cancer patients, glaucoma patients, chronic pain patients currently have the option of using medical marijuana. Not all take that option, but the option is available to them. Why are we not giving this option to patients with post-traumatic stress? The doctor and the patient are the ones that know best how this disorder is affecting this person's life. If we save one marriage or prevent one suicide and return somebody to productive society by allowing them access to medical marijuana as a diagnostic criteria without having something else that we have to kind of sneak them in on, I think that it's worth it. When I first started doing medical marijuana, a very wise physician told me what marijuana does for people. The normal state of affairs as a human being is to have an appetite. It's to be without pain. It's to be able to sleep. It's to be free of anxiety. Marijuana acts as a moderator to bring you back to that steady state. We need to be able to offer this to people with post-traumatic stress. Thank you.